Mr. Chair and members of the committee, my name is Lori Chovanak, Chovanak. I'm the Executive Director for the Montana Nurses Association, and I appreciate your time today. We brought House Bill 269 forward, and from my vantage point in my desk, several emails, messages, inquiries came across in support of our efforts to bring this to you. Travel nationally, and I hear the national buzz. It doesn't surprise me at all. 38 states have enacted laws to address this issue. Our parent organization, the American Nurses Association, has dedicated areas of their webpage specifically to provide information regarding violence against healthcare workers. And I have 3 letters here I want to pass out that were sent from nurses for their personal testimony.
Okay. Thank you.
So you've heard from proponents, and I could echo everything they say as the Executive Director of the Montana Nurses Association. However, I reflect on my own 20 years of nursing practice, and I really had to get thinking about what I've experienced, and would like to share that. Just this past week, I spent some clinical time with APRNs up in Great Falls, and they expressed a story, knowing I was coming forward today, that they actually had a patient that waited in their parking lot as they were closing the doors, and it was a patient that they had refused medication, pain medication to. They ended up having to call 911, and the police came and asked that patient to leave. Authorities waited, and the patient left and then came back. They ended up actually arresting that patient. What they found in her car, along with the gentleman that was with her, was also arrested, were firearms and then a bag full of narcotics. So they now take extra precaution in their clinic to take care of themselves. After 20 years of nursing, and I reflect back, as a student nurse, I was studying with my friend, and a knock on her door that evening was a patient that she had taken care earlier that day who was intoxicated. It was very scary as a nursing student, something I never forgot. And we called 911, and of course authorities came and took care of that. But we took that story back to school, and I'm pretty sure everyone I graduated with still remembers that that happened to Jennifer and I. On my first job as a nurse, I quit 9 months into that job. I was 3 months pregnant with my first child, and the patient told me, "I will kick you so hard in the stomach, your baby will die." And my only reaction to that was, I can't work here anymore. I need to find a job where I feel more secure. So I gave 3 days notice and begged them to give me a good reference for my next job because I didn't feel safe showing back up. They actually understood, wished I would stay, but I moved on. I moved on to the surgical floor, and I worked there for 4 years. And when I reflect back, an instance there, just not being able to administer pain medications to one of the patients in a timely fashion because of the way the order was written, turned to walk out of the room and got hit in the back with a full water pitcher, and nothing happened with that patient. And then from that department, I moved to the ICU for another 4 or 5 years, where during that 4 or 5 year time period, my friend, who was a pharmacist, was held at gunpoint and robbed in our hospital pharmacy on the night shift. She quit, and she never came back to work, and I think she's working back in pharmacy now, but that was about 15 years ago. It took her quite a while to get back into it. And then finally, reminiscing, currently work in the X-ray department at my local hospital, and recall a patient waiting for a procedure who was very irate, yelling at me in the middle of a full waiting room, and telling me that I should leave her presence or she was going to punch me in front of a whole waiting room full of people. At any rate, what I wanted to do was share not only from my position at M&A, but as I reflected back last night, I realized that I haven't worked in the ER. I haven't worked in some of these areas where there's really a lot of stories and things that have come forward, but just in normal practice moving through my career, I think I've looked at this as a normal part of the job, and that's not what it is. It should not be, and we need this bill to help make our workplace safer so we can take better care of the patients. Taking care of a lot of patients with mental illness, a lot of patients that have gone through DTs, a lot of patients that have confusion and that are senile, and these are not the patients that we are talking about. This bill would not be, it gives us the option to take the penalties. Each incident would be looked at and treated on an individual basis. And I think any patient that has knowingly and purposefully done this is one thing. Those that don't know, they need our care. Thank you.
Thank you, Ms. Chovanec. Further proponents?
Good morning, Chairman Kearns, members of the committee. For the record, my name is Amy Gromolez. Last name is Grmoljez, and I rise today on behalf of the Billings Clinic. You've heard some very good points, so I'll try not to repeat testimony. Specifically from the Billings Clinic emergency room, we have 40,000 visits a year. I have testimony, Mr. Chair, with your permission, from Brad Van Bergen, who heads up our emergency room department, to give some specific examples similar to what you've heard. But suffice it to say that facilities like the Billings Clinic that have 40,000 visits see a number of patients who are not violent. But the reality is, if I look at a community like this group, we report that over 50% of visits potentially have violence attached to them. So if you think about this group right here, from the chairman through Representative Eck, there's a potential that in your service you would have some sort of violence attached. Who would sign up for that job? I mean, as a legislator, would you say I'm really excited that I've got a 50% chance of having violence? I don't think so. I'm a lawyer and lobbyist, and a lot of people might not like my profession, but I sure don't get signed up that 50% of the time I have a chance of having violence. So I think with that in mind, healthcare workers may deserve a different standard, and for those reasons, Mr. Chair, members of the committee, we do support this. Thank you.
Thank you, Ms. Gromolez. For the proponents?
Mr. Chairman, members of the committee, my name is Terry Minow, M-I-N-O-W. I represent MEA-MFT. MEA-MFT rises in strong support of House Bill 269. We represent a number of nurses and healthcare providers. I would just echo the excellent testimony of the healthcare providers and emergency responders that you've already heard. This is a very important bill. I hope that you will give it a serious look and give it a due pass. Thank you, Mr. Chairman.
Thank you, Ms. Minow. For the proponents?
Good morning. My name is Robin Haux, H-A-U-X, and I'm a labor representative for the Montana Nurses Association. And as a labor rep, I've had the privilege to meet and learn from these wonderful, caring people. Over the past 6 months, I've visited with a number of my nurses in ER departments, X-ray, and public health departments, and heard stories about many frightening situations and how much these are increasing. I support House Bill 269 because I believe it is time to protect the nurses and other healthcare providers who care for us. Thank you.
Thank you, Ms. House. For the proponents?
Good morning, Mr. Chairman and members of the committee. Maureen Connor, C-O-N-N-O-R, for the Montana Association of Counties. The counties agree with and support the previous testimony. We support our Montana nurses. One of the previous testifiers indicated that it was an attack on the uniform, and I would like to offer that to bring something new, just to remind you that this bill would also protect our emergency EMT volunteers who are responding all over the state. They are wearing uniforms. Their uniforms typically have the giant cargo pockets that are very popular these days, but they're full of tape and bandages and little books and things like that. In addition to this, I would like to encourage the committee to protect the people who are trying to help others on their bad day. And Mr. Chairman, I have a message from the Montana County Attorneys Association, who is upstairs right now, and they would like me to indicate to you that they support this bill and would be able to prosecute. So thank you very much, and I'll be around if there are any questions.
Thank you, Ms. Connor. For the proponents? For the proponents, seeing none. Opponents? House Bill 269.